Hey everyone, Dr. Shook here. Hope you're doing well today. In today's video, I want to talk about two key supplements that most people should be taking, especially if you have rheumatoid arthritis or any autoimmune condition. So the two supplements are vitamin D and some type of fish oil, some type of essential fatty acid. Now, the primary reason for these is because vitamin D has an incredibly powerful effect on your immune system. So it affects something called regulatory T cells. Now, these immune cells help to make sure that your immune system basically doesn't overreact to things, that you have a normal immune response to things. And so that's really important because if you're autoimmune and your immune system is attacking your tissues, you really need to have better regulation of that system. And vitamin D and getting your vitamin D levels optimized, which I think are in the top 25% of the reference range. So it is helpful. You do need to get a blood test, but it's usually really simple to do. You can self-order those sometimes if your doctor won't order them, but most people's primary care will order them. When I work with people, it's always something that we get. So, okay, vitamin D, it helps with making sure the immune system doesn't react abnormally. The next thing are essential fatty acids or fish oils, primarily omega-3 fatty acids. Now, these are incredibly important because they help to support the production of resolvins and protectins. Now, these chemicals are helpful at resolving inflammation. So they're really critical at helping to dampen the inflammatory response. See, a lot of people that have autoimmunity, when their immune system starts attacking their tissues, first of all, it doesn't recognize you or your tissues as you, which it would normally not react against. So it's lost this identification, or what we would call you have lost self-tolerance. The immune system no longer sees you as you and no longer tolerates those tissues. It's reacting against them. So it's an abnormal response. The other thing is that the immune system, a lot of times with autoimmunity, you'll see that people will have persistently high inflammatory levels, and they're unable to resolve that inflammation, to dampen it, and for the immune system to calm down and come back to a resting baseline. So these are absolutely critical. Now, with your omega-3 fatty acids, I like to look at the omega-3 to omega-6 ratio. So you can do a blood test called the omega check. There's a few different names for it, but there's a single or a simple finger prick blood test you can send off to the lab, and they'll assess these levels. You can also do that for vitamin D. But if you're struggling with autoimmunity or you have any of these challenging conditions with rheumatoid arthritis, I work with people around the world via telemedicine. I also have a free program, the RA Reset program. I have a program for Hashimoto's and psoriasis, which